14, 2025. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. Our patient presents with a torn muscle in the buttock called the piriformis muscle syndrome. People have buttock pain. It feels like an ice pick, but they can also have sciatica. It's the second most common cause of sciatic pain. Numbness, tingling, weakness in the leg due to the sciatic nerve being affected as it passes through the piriformis muscle right where the tear is. The piriformis muscle attaches to the top of the hip to the greater trochanter. That's being outlined for you right there with the white arrow. Henry, let's show the audience how piriformis muscle syndrome, the third most common cause of lower back pain, how it causes so much disability in patients.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. We're almost done with this patient's piriformis muscle release. Any questions?
No current questions, but we do have a comment coming from Lanu on YouTube.
Well, hi, Lana. Welcome.
Saying your team should enter the TV game show Family Feud, a great way to introduce your clinic to the world.
I love it. So you like Family Feud, huh? Isn't Lanu in Indonesia? Or is it Malaysia?
I think it was Malaysia,
right.
But I could be wrong. And,
well,
yeah.
I would love to do that if we could someday. Thank you. Thanks for joining us. We're finished with the piriformis release. Everything's gone well. Thanks, everybody. Great job today. We'll be back, folks, shortly with another patient that's having a lot of work done. He's having his back fixed and his neck fixed. So we're going to be in for a lot of different procedures on that patient. Who has this stuff here? Can we move this? Thanks. Henry, you want to end with one of our patient testimonials?
Of course.
And good morning, I'm Dr. Deuk Majan. I'm here with a patient from Kentucky who came here for a couple of issues, but one of them was piriformis syndrome. She had a torn muscle in her buttock. It was balled up tight with scar tissue, spasming all the time, causing buttock pain and compressing her sciatic nerve. So she had sciatic pain down her leg, and you had the Deuk piriformis release yesterday. How do you feel?
Today, I feel really good. I no longer have pain going down my leg into my foot and heel. I just have some muscle soreness now, and we're at the surgical site.
And how long have you had that piriformis syndrome?
At least 8 years is when I first noticed it.
Yeah, 8 years. So, and the muscle was very scarred, and when I had to release it, I could feel how thick it was and how tight it was. So it went very well for you. What kind of problems did the piriformis syndrome cause for you in your life?
It got to the point where I would not leave the house because I could only go to work and come back because it hurt so bad to work and to do anything after work. I've had 2 surgeries on my hip, and the second one was a total hip replacement, and the pain was still there.
So you had hip surgery that didn't even fix the problem, and then you came to Deuk Spine, you woke up.
And It's much better. I can walk without pain in my foot and leg. Like I said, just muscle soreness at the surgical site now.
How did you hear about Deuk Spine Institute?
Online, I was Googling my symptoms and your website kept coming up and I ignored it for a while because I really just wanted to stay in my area if I needed any surgery done. And I finally decided, well, there's no one in my area who can help me. And so I clicked on your name and I thought, wow. Started watching your videos and saw that you had a free MRI consult.
Mm-hmm.
So I did that. Now here I am getting it taken care of.
Well, you hit the nail on the head. There's no one in your area that could help you. And that's true for millions of people suffering with back pain. Their doctors cannot fix them. So that's why we are so active online, trying to make people aware that there is help for them. But they have to travel to Florida. Well, right?
Yeah.
Beaches.
It's an easy jump down here. So
yeah, and you could see in the surgery, we went in with a 4-millimeter incision. And this is a pioneering new technology where I went in and released the piriformis muscle with almost no bleeding, no hospitalization. It was outpatient. So you actually went to your hotel with your daughter right afterwards, and here you are today.
Here I am.
So how is life looking for you now without this piriformis problem?
So much better. I am looking forward to getting back to my normal level of activities. One of my goals is to get out and hike, again, 5 or 6 miles a day. And like I was doing, I'm looking forward to that.
Awesome.
Yep.
Anything else you want to say to your family and friends and fans out there?
I would say that, do your research, but you're going to end up back with Dr. Deuk. There's no one like him that I found. I did a ton of research throughout the country at first, and then I focused on my regional area, and there was, you're going to come back to Dr. Deuk without any hesitation.
And we welcome everybody because we want everyone out of pain. That's our goal.
Yep.
That's our mission at Deuk Spine. Get rid of pain permanently so people can have a normal life and enjoy life.
Right.
Well, congratulations.
Thank you.
You took the leap of faith. You came here and got it done.
Yes, absolutely. Thank you so much.
You're welcome.